Four qualities needed for a patient. I can't say being a good patient or a bad patient. If the patient possesses these four qualities, the rate at which he gets cured is much better.
Welcome to yet another episode under the world as doshas. Today in the shloka of the week, we have come to the fourth pada of the Chatushpada, the fourth. We said there are four things which are needed to complete a treatment. Okay, and today we are going to discuss about the qualities of the patient. And if the patient actually possesses these qualities, then we consider him to be a superior patient, in the sense, he has got all chances of recovering faster than other patients. So let us try to see what are these four qualities. So this is also from Ashtanga Hridaya Sutra Sthana. Okay, first chapter, the 30th shloka. So under the shloka of the week, we get into the Chatushpada, the fourth Chatushpada. Okay, with the four qualities of a patient. This is how the shloka goes. Aaddya, rogi, bhishak, vashya, njapaka, satva. Okay, so you can see the transliteration. Aaddyo rogi, bhishak, vashya, njapaka, satva. Okay, so let us get into the meanings. There are four qualities. One is aaddya, okay, one is bhishak vashya, one is njapaka, another is satva. Okay, these four gunas are the qualities he should possess. Aaddya means he should have the means to go through the treatment, money, whatever it is. Those things very much necessary. Bhishak vashya. Bhishak means the doctor. Vashya means under control. In the sense, he should have obedience. If the doctor asks him to do something, he should follow that to the T. Okay. Njapaka is somebody who's got very good memory. If the doctor asks you to take a medicine at a certain time, you have to follow that. And Sattovan is somebody who's got Sattoguna and who has got a positive outlook towards life. Okay. So these four qualities are very much necessary. Let's try to get a little bit deeper into this. Okay. So aaddya means a person who's got that money. In the sense, nowadays, if you look, you might, if you get into any hospital, you might not have that kind of money, but do you have access to money? In the sense, it might be in the form of insurance or somebody paying it up for you, or you yourself having the money. So what happens here is, sometimes the doctor asks you to undergo a certain test or a certain treatment, which might be the only treatment possible for your condition. And if money is the constraint, okay, then that treatment doesn't happen properly, and then you might have a problem. So it is very important that the patient has his means. So nowadays it's not that big a problem because you have got insurance coverages for a lot of things. I recommend that all of you take health insurances. Okay, I'm not advertising, but still, to be on the safer side. Second thing is aaddyo rogi bhishak vashya. Bhishak, as I said, is a doctor, and vashya is under control. So he listens and obeys to the doctor, because the way the doctor actually thinks about what your condition is. Sometimes you might have been under the treatment of some other doctor who's got a different way of looking at it, and this doctor has got a different way of looking at it. Both doctors might not be wrong, but when you are following the protocol of a certain doctor, it's always good that you listen to him. And I would say, it should be a complete surrender or trust in the doctor's capability to actually handle your condition. Trust him. Bhishak vashya, you should completely trust what he is basically trying to do to see that you get okay. Number 3, okay, njapaka. That means the doctor might give you small instructions. Don't do that. I forgot. That should never happen. The timings of the medicines and what kind of medicines you have to take, all those things you can't forget. And moreover, njapaka is also that, when you are undergoing a treatment and there are certain symptoms which have come up of late, don't forget to convey that to the doctor. Don't think that everything is like, you should keep a track of how your treatment procedure is going and what all symptoms come up and how you feel. keep it in mind. If you don't, if you want, you can also write it down, and then you have to put it across to the physician so that you are exposed to the best treatment. So memory is very, very important. Okay. Sattvavan is somebody who has actually got a lot of sattva guna. Sattva guna doesn't, see, it also means that he has a lot of mental strength. There might be certain treatments which, probably removing blood or giving a vasti, you mean medicated enema, all those things, you might get confused. Trust the doctor, and you should also have the strength to go through a treatment. Okay, having that mental strength is very important. In the sense, you might be physically very strong, but if the doctor says, no, I just want to remove a little bit of body, I'm scared. Those things don't happen. And you should always have a positive outlook towards everything in life. Then what happens is, if the doctor says you'll do this, you'll be okay. If you trust the doctor and have that positive, that sattva guna in you, you will definitely get cured, or it makes a huge difference. So it is not about curing. Curing is not in the hands of the doctor. The doctor only treats, while nature takes care, or the body knows how to heal. It's all his grace. So you should basically have these 4 qualities. Okay, aaddya, yogi, bhishak, vashya, njapaka, and satva guna. If all these 4 things are there, then you are a candidate to become a very, very, very good patient. Thank you.